And welcome to Lesson 4. In this lesson, we're going to talk about overcoming billing obstacles. And this section really breaks down into just two subsections, and that is understanding self-funded benefit plans and understanding private plans. So let's look at these. We'll start with number one, self-funded plans. So employees who work in a union environment are classified as plan members, not just employees, but they're plan members. They're plan members for a reason, and that's because they're contributing some money from their paycheck each month into a group benefit plan that's going to help fund all of the health benefits that are available. Now, they usually do that in conjunction with the employer. So these types of health benefit plans usually have two plan sponsors. So you have the employer who's contributing often 50% of all the money that goes to fund the group benefit plan. And then the employee or the plan member is also funding the plan, usually about 50% as well. So they have a vested interest and they have skin in the game, if you will. And this is true also for the pensions and the disability management plans in these union environments. Usually the employer is paying half and the employee is contributing money over time as well. So the person who's really adjudicating all this, usually they're called a third-party administrator of some type. They want to keep the plan member or the employee happy, or they complain to the union leaders, which creates a very uncomfortable and undesirable situation. So the unions, of course, want their members to be happy, healthy, and to enjoy the best quality of life possible. That's really the key mandate of the unions. So what does this have to do with nutritional counseling? Well, in some plans, the nutritional coverage states that in the wording that they have nutrition coverage, let's say it's $500 a year for a nutritional service provided by a naturopath or a registered dietitian. But if the plan member chooses another type of nutritionist to see, let's say a registered nutritional consultant practitioner or a registered orthomolecular health practitioner, the claims adjuster in this case is usually very flexible and accommodating. They don't want the plan members who are paying into the plan to be penalized for trying to get healthy and remain a functioning working member, because they actually value the fact that the member is working to be healthy using natural and proactive methods, which ultimately help to reduce drug costs, absenteeism, and disability claims. These things cost a lot more than simple nutrition counseling. So what really costs the unions and employers a significant amount of money each year are rising drug costs, absenteeism, and disability claims. Nutrition counseling doesn't eat up a lot of the costs in a group benefit plan. If the odd member goes for nutrition counseling and uses up their $500, that's not depleting the plan in a serious way. It's drugs and absenteeism and disability that's really costing them a lot of money. So in these self-funded plans, drugs and disability claims are also funded by the members and also by the employers. So one of the goals of the adjudication claims team is to value members who are working to stay healthy and remain healthy, because they tend to be less of a liability regarding drug costs, disability, and other health care costs that the plan would be required to pay. So we know that healthy, proactive employees or plan members don't deplete the financial resources of the group benefit plan compared to unhealthy members and members who have really poor healthy lifestyle habits. So in self-funded plans, as a rule, when an employee or a plan member seeks the help of a credentialed expert for nutrition and lifestyle medicine counseling, the claims adjuster usually is happy to honor the claim even if the service was not rendered by a naturopath or a dietitian. So other types of nutritional credentials are honored often in self-funded plans, even if it's not explicitly stated. That's been my experience, because they want to keep the plan member happy, and they know that the involvement of proactive, healthy lifestyle habits reduces the bigger costs: drugs, disability, and absenteeism. So when I have a patient whose group benefit plan is a self-funded plan, they work in a union environment, I provide the patient with sort of a form letter that I created to submit to their claims adjuster, explaining my nutritional credentials. Now, I have a master's degree in nutrition, but that usually doesn't account for anything. What's more important is that I have an ROHP, a registered orthomolecular health practitioner designation from the International Organization of Nutritional Consultants, the IONC, and I have an IONC registration number. And they usually approve the nutritional consulting service for the patient in advance so the patient is not wondering if they're going to get reimbursed for the claim. So we try to get approval up front. I'll explain more about the ROHP and the RNCP designations from the IONC in Lesson 5, which I think you'll find very compelling. Now let's move to private plans. Now in private plans, you have an employee that's working for a company. It's a non-union environment as a rule. And often these private group benefit plans are underwritten by insurance companies that are doing this on behalf of the company. So often the employer is paying the larger part of the freight to keep this going. But even in these cases, the claims adjuster is aware that employees who seek guidance around nutrition and lifestyle practices are likely not going to drive up drug costs, which actually are the main driver of increased health premiums year after year for employers, is that the drug costs keep going up. So the group benefit plan has to it starts costing the employer more year after year. And this is especially true for certain drugs like high cholesterol drugs, drugs to manage type 2 diabetes, drugs for high blood pressure, drugs for anxiety and depression and sleep aids. In many cases, as you know, nutrition and lifestyle medicine can help to lower these risk factors and improve management of these conditions, naturally reducing ongoing drug costs. So in this instance, the employer wins, right? Because their premiums will stay lower if fewer of their employees are utilizing all the drugs. And the employee wins because they're healthier, and the insurance company then now doesn't have to keep raising the premium on the company year after year, because as they come back year after year to the CEO and the chief financial officer and they say, your group benefit plan, the premium is going up another 10%, another 10%, another 10% year after year, the company starts looking for another insurance company to replace them. They start looking at competitors. So if an employee of that company is doing what they can, using natural interventions to try to stay healthy and reduce their reliance on drugs, which are the big cost, usually the claims adjuster's pretty cool with anything the person's willing to do. So once again, in that situation, I provide the patient with a letter from my office in advance of the nutritional consulting service I'm going to provide, explaining my credentials and explaining the purpose of the consultation and the benefit to the patient and related drug and disability savings to the benefit plan and the employer. And this is usually all that's required to get approval. Remember that we're talking about a nominal figure, $500 for an employee to get some nutritional counseling. We're not talking about thousands and thousands of dollars spent on drugs and dentistry, which are the two main big costs in most group benefit plans that are sort of private. So this has been my experience as an ROHP, or a registered orthomolecular health practitioner, when I provide nutritional counseling. So I'll talk more about those credentials again in Lesson 5 as I promised. Now remember that many patients are looking for help and they don't have any coverage at all, and they're not even concerned about reimbursement. Patients that I see that have Parkinson's disease. Recently, a medical doctor sent me a patient who has Lyme's disease, who was not really responding to standard medical treatment, and saying, what could be done from an integrative standpoint? Person now doing much better. They weren't concerned about reimbursement of the claim. People who want advice on healthy aging, kids that have ADHD, parents willing to pay out of pocket. It's not always about reimbursement. Many people have some form of coverage, but many people are happy just to pay out of pocket if you can help them with a serious health problem using natural, non-toxic interventions. So once again, the real problem is finding a nutritional consultant who can provide these services using the best available evidence-based solutions, and who can work in conjunction with, not in opposition to, the patient's physician and/or specialist. That's been the key to my success personally, working in a collaborative way and providing evidence-based literature and clinical studies so that everyone knows that we're coming at this from an evidence-based standpoint, and not slamming or in any way being antagonistic to the medical management that may be happening concurrently. So we're going to discuss a lot of this in Lesson 5, getting the right nutritional credentials behind your name and making it happen with a fast-track solution that honors your previous and present-day training and practice in the healthcare field. So I look forward to seeing you in Lesson 5.